This cloud represents the condition of ignorance and superstition that hung over medicine for millennia. If all of history, from the pharaohs to the present, were plotted on one calendar year, what we know as modern medicine would begin in the last week of the year. Taking a huge, encompassing view of the history of medicine, it begins with the Code of Hammurabi, written over 3,800 years ago, which is the oldest form of written law. And that actually contains a reference to what we now refer to as malpractice. If a surgeon caused an injury, he lost his hand. Ancient Egyptians were somewhat familiar with anatomy. They performed simple surgeries, set fractures. Hippocrates is credited with applying the concept of the four humors to medicine. Humorism was a quick way to diagnose problems. For example, if you were easily angered, it was because you had too much yellow bile and meant that your gallbladder was diseased. Certain organs were associated with each humor. Blood, for example, was a hot and wet environment and was associated with the element of air. If you had a balanced blood, you were sanguine and prone to an amorous and generous temperament. Too much blood, and you might go overboard and need bleeding. Not enough, and practitioners would fill you up with red wine because it looked like blood. The approach of the four humors dominated medicine for nearly 2,000 years, and medieval practitioners continued with this form of diagnosis well into the Renaissance. But it's also interesting that we, moderns, are going back to a holistic approach to medicine, combining body, mind, and spirit with one's overall health. It's a little more complicated than the medieval side, but it wasn't a bad place to start theorizing. Delving a little deeper into medicine in ancient Greece and Rome, Hippocrates essentially started Western medicine. He had a program for good health, which is very reminiscent of what we use today: rest, exercise, good nutrition. He established medicine as a profession and was the first person to believe that diseases were caused naturally and not as a result of superstition and the gods. And his Hippocratic Oath is still used today. Another very important person among the ancient Greeks and Romans was Galen of Pergamon. The major contributions that he made was that he performed anatomical experiments on animals that greatly advanced our knowledge of the circulatory, nervous, and respiratory systems. He performed surgical operations on human patients that would not be used again for centuries, including surgery on patients' eyes and brains. In fact, he performed cataract surgery similar to what is being performed by contemporary ophthalmologists. The study of his work went into decline in the Middle Ages, unfortunately, because few Latin scholars could read Greek. From that promising start of medicine, we've now entered into the fall of Rome and the Dark Ages. So from about 200 to 1200 AD, there are very few medical advances. Ecclesiastical learning took over everything, including the study of medicine. Relatively little was learned in terms of advancing medicine, and what was learned was supplanted by healings offered at shrines and by holy men. During this period of history, tales abound of miraculous cures via shrines and icons. In fact, some of the saints of note were Saint Roch for the plague, Saint Herbert for rabies sufferers, and Saint Blaise for throat complaints. During this period, think of it as little advance in modern medicine and the preeminence of do-it-yourself handbooks.